Well, greetings again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk to you a little bit about ectopically erupting 6-year molars. This on the bottom. This is a pretty common thing that happens, and not too long ago I heard that somebody interviewing some orthodontist or something. I don't know, whoever dominates these schools somewhere, and said, do pediatric dentists know how to do ectopically erupted teeth? And the guy said, well, I feel like the orthodontists are better equipped to do this. This ridiculous idea that a pediatric dentist can't upright a 6-year molar or a molar in this position. I want to show you it is a simple, easy thing to do, and a pediatric dentist should be doing this, and they should have been doing it 50 years ago. I'm a general dentist, and I was doing it then, and I could do it as good as anybody going. I'll show you what we do right here. And it's ridiculous that we tell the pediatric dentist you don't have the facilities to do ectopically erupted teeth. You can't send the child to orthodontist to get some little nothing done like that while you're coming along, and if you leave it alone, it is one of the biggest messes. You'll use up most of your length over here, and you'll have to extract something. But it's very rarely do people go in and push all these teeth back when this happens. Let me get over here and get into this thing, and let me see if I can touch that. Here's a little girl, just a neat little gal, and she's as fun to work on. I enjoyed just kidding her and joking with her, and she's just a sweet, wonderful child. And she came in with an ectopically erupted 6-year molar, and I didn't even have to do it this good. And I'm a general dentist, and I've been doing these for 50 years. And you tell the pediatric dentist that's doing graduate work doesn't know how to do this. This is so stupid. I wish that Roy Wolf was still alive. He's a pediatric dentist in St. Louis, and he had a study club of about 150 people, and they paid so much a year to go to it, and whether they came to hear you or not, he didn't care. But the large group would come, and I've been up there speaking to those pediatric dentists for several years. I came up there and talked to them about doing things in pediatric school. Okay, here is a situation. You don't even need a bracket to do this, really. You can bond this wire right onto these teeth like this. This is a deciduous tooth, and the 6-year molar has eaten the whole distal root of it away, but that doesn't kill the nerve in the tooth. It's still alive, and you need to back this tooth out of this hole. It's very simple to do. Now, here we made a little spring right here. You had it run like that, and then we looped or something like this, and maybe we put this on this when this was down here, and this arm would be way down here. We'd raise it up and hook it right behind something, because when this tooth comes out, it's going to go back in that direction. Now you can see it on the x-ray. It's plain as day. This is such a complicated little spring here that I don't think pediatric dentists know how to do this. Such a ridiculous answer to a question like that. I wish I could talk to the head of the pediatric school in all these places where they won't even let the people of American Orthodontics come and lecture to them on anything. Why can't they do that? They're being dominated by the orthodontic department. They won't let them come in. Then they should tell the orthodontic department to go to you know where and do what needs to be done as a pediatric dentist, and quit all this nonsense that people in a pediatric dentist can't do this and can't do that. They can do all of this stuff. You hire an orthodontist. How many orthodontists go to school and they teach them how to do ectopic eruption? I've had people that hired an orthodontist, then they had to teach him how to do that, and then he would do it. Why not let the people do it themselves? It's so simple. All right, here this tooth is. It's down in underneath here, and it's eating the root of this tooth away. I've seen stupid, ridiculous things. People would stick a piece of flexible metal down in underneath here, bring it over here and bond it to the teeth like that to get this. In other words, they're using this tooth that's already lost one of its roots to push this 6-year molar backward, and that's about as stupid as you can possibly get. And that's a fact. This works perfect. All you need to do is just take something, uncover the side of the tooth, bond a tube onto this tooth right here, and then take a spring like that you can make go out here however you want it. Now you stick it in a place like this. This part's going to go down here. So sometimes you have to tie it back up, or we reach in here and stick it right behind. This is on a deciduous tooth with all of its roots. So the pressure on this will take this tooth, it'll shove it back, and it'll shove the second molar in the wisdom tooth back, and it'll go in place. I have never seen an ectopically erupted or tilted tooth on anybody at any age, at any time, that you couldn't do it with a little spring and a little bondage material laid on here. And every dentist really that goes to dental school ought to know how to do that, and ought to pick this up instead of making a bridge that's leaning over, something like that. Now watch this thing move that tooth, and watch this go back here. And you don't even need a bracket or anything. Just bond your wire on that tooth right there. Hook it up behind one of the bonds. And here it is. Now I'm 96 years old right now, and I'm not going to be here to fight this battle for the pediatric dentist. So I want pediatric dentists to get off your rear end and fight for what is right and what you ought to be able to do. And every one of you ought to know this kind of stuff like this needs to be done whenever it shows up, just as quick as it can. Look at it, it's eating the root of that deciduous tooth away. You stick some silly thing in here to try to prise it back, that's dumb. I mean, you're tending on this tooth to shove this back and this back and this back here. You take this, put it over here on a tooth with a good root on it, raise it up, hook it there, and when it goes back, this tooth will back this whole thing up. I don't care who you are or what it is, it has that much power in there, and watch it work. All right, here it's been on there, I don't know how many days, let's see, that was 4/18 of 86, and this is on a 9-year-old, 6 months, 9 years, 6 months old child, just a real sweet little girl, and I enjoyed working on her very much. Now, this is 86, that's 2/21 of 86, and that's 4 of 86. Just the small amount of time it takes. Now this tooth is reared up. The roots are in the bone, and it's moving up, and it's going to move back and leave a space in there. This tooth is healed here, has already moved there. It can move over here now. It's getting some of its force from this one root right here. Actually, It should have been further back over here using teeth with full roots on them to do this. But this worked anyway, stick it out like that. Now this tooth is not dead, that's just eating away right here. Now this tooth will come in. If you leave it alone, this tooth will go, this tooth will lean way back in here. It'll come over here, then these teeth will all be cluttered up and then in a big mess. An ectopic eruption should be done when you see one of them. I mean, you know what's going to happen. And it ought to be done in every pediatric dentist. Every dentist that works on kids ought to know how to do this. This is stupid. Now, hear this thing. That little spring right there, started over here and moved back. It was using these roots, and it ended up with a tooth over here. Now all you got to do is just keep a little of this pressure and pull the tooth forward, or just let her come in, and this tooth will come on up now and come in there and hold it back in place. And there it is again. There's a view of it. There's the little spring right there. This is so complicated. I just know that pediatric dentists can't learn how to bend this complicated thing. What a ridiculous, stupid idea that somebody's keeping these pediatric dentists and dentists in general. Don't tell them about this. You can put that on any tooth there is on any body. And you set it up there right, and it'll set that tooth up. There's no sense in making a bridge leading here. Pull it up here, and now put that in. Every dentist ought to know how to do this. And I'm tired of, I can't get out there and go much longer for the people. So somebody pick up and get going with this, and ignore whoever is trying to keep you from doing it. It is a ridiculous, stern idea. Here's something that should be done by every dentist. And why not teach them some of this in school? What are you teaching them? All this junk ways to do things. Do something that's going to do something good. And that's what happened here. And we raised that tooth up, hooked this thing over here. It got most of its weight on this tooth, and some of the root of this tooth, this other root is gone over here. And now it pulls it up here. Just hold it there and pull forward on it, and you've still got this force, and it'll hit the tooth up above and fall right in line. And this is a necessary thing for everybody works on kids. Ought to know how to do this. And why not teach it to them in the dental schools? Whoever's paying the bill to go to the dental schools. This ought to be something known by everybody. You don't even need any. You just bond a wire over here. No matter, you can buy a little piece of rectangular wire, just a tube or something to stick over here, and this will work. Now, it's like that, like that, like that. And that happens. And this will be true 100 years from now without any question. This will work then. This old deal of 50% of what I know is going to be wrong, and no, well, this is truth, and it doesn't fail, and it'll be that way. You can do this tooth like that 100 years from now, and it'll still be just as up to date as it is today. So I'm going to hush up, and here's this sweet little girl. We got the tooth up right for her, and she was a joy to work on. And that patient, that's why maybe you live a long time, because I have the joy of seeing this stuff take place on young people or anybody. and it makes you damn glad you're alive. So I'll shut up now. Bye-bye.